Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today's guest is Dr. Luis Barata, an independent or autonomous practice nurse practitioner in Florida. He's board certified in both family and lifestyle medicine. And he also had received his Doctor of Medicine degree from University of Havana, Cuba, and University of Chile. And then he practiced as a family medicine physician in South America. He was born in Cuba, but a resident in Florida for over 15 years now, and his focus is really preventative and family medicine. Dr. Barata is the founder of Riverside Family and Lifestyle Medicine in Cape Coral, Florida, where he and his team of dedicated healthcare professionals provide a robust array of primary care services. He's a firm believer in the power of lifestyle medicine. He walks the talk himself while he's also using lifestyle medicine as the foundation on which his medical care is constructed. And he believes that lifestyle medicine is the future of medicine and that these concepts should be integrated fully into conventional medicine education and practice. So thank you, Dr. Barata. Deborah and I are really happy that you're here to talk with us today. Thank you so much.
Thank you for giving me the opportunity to be present today. And I'm so honored to be here. So thank you. Thank you too
Yeah.
for having the opportunity.
Thank you. All right, let's start with the origin story. Can you tell us about what you're doing right now? Fill in any gaps. I'm sure I missed a lot of things. Fill in any gaps for what your role is right now and how you discovered lifestyle medicine or preventative medicine. Was that always part of the fabric of your practice, or did something happen that kind of put you down that path? Tell us about that.
Yes, of course. Currently, my role is as a family nurse practitioner here in Southwest Florida, practicing in a very busy primary care office that is doing primary care in the first place in lifestyle medicine in Beverly. I started studying medicine in 1985 in Havana, Cuba. And after graduation, I did my specialty in family medicine. I was board certified over there and started practicing family medicine. We used to have an array of patients, like 1,200 patients around that, with inclusion of pediatric population, OBGY population, and adult and older adults as well. And we used to do preventative care, what family medicine physicians does. And that was the base of my interest in family medicine. Then I moved to Chile. I became a physician in Chile as well. and continue to practice in family medicine there with the same concept, the same pillars to say something. But I always see my patients getting worse and worse. And now being successful most of the time with my preventative care toward them. So then finally I moved to the US and I've been living in Florida for 15 years already, as you said. I became a nurse practitioner and life happens. And I found myself in a not very healthy path at some point in my life. Back in 2019, I like 35 pounds more than I have today and so tired all the time. And the last thing I did was a blood test, which I've done for a very long time. And my cholesterol was skyrocketing. And but the real miracle was around those days, I received a random email from American College of Lifestyle Medicine. And the subject said lifestyle. And I go, that was I was thinking, that I have a lifestyle problem. I didn't even think in statin or anything like that for my cholesterol. I think I have to do something with my life. It looks like I know what to do and I'm not doing it. Long story short, I ended up contacting ACLM. And that same year, it was in June 2019, that same year, November, I was certifying during the conference and start my journey with ACLM. From that moment on, it was amazing. I started myself the lifestyle of whole food, plant-based nutrition, and then today 35 pounds less and normal cholesterol. I'm here trying to educate my patients every single day in my practice.
I love that. Yeah, so you had your own experience, like your own physical experience with lifestyle medicine. And I think that's really powerful because I have a similar story that when you're trying to educate and connect with a patient, you yourself, when you've had that personal experience, it just really solidifies that common connection. So I
Yeah.
love that. I love that story. Thank you. So how do you integrate it into your daily practice? It seems like you put that front and center with like your website and your marketing. It must be something that you just felt so passionately about that you created your whole work around this.
Yeah. But when I discovered this new path, I was working for a big company and I was trying to do something lifestyle medicine within the system. I was constrained, time constrained, and people all the time rushing me. I decided, you know what, I need to. I don't know how it's going to be. I have no idea. I have no experience. I'm not a businessman. So I'm going to just jump in. I contacted a friend of mine that is a very good person and very good administrator as well, an office manager. And with her, we started the journey. And the first thing came out to my mind in the name wise was lifestyle medicine. So I blend some, and the name came out Riverside Family and Lifestyle Medicine. I used to, in Cuba, I used to live nearby the river. And then that was where I grew up. And that's why the Riverside name, and then the rest. And it's hard. It has been hard and hard to trying to keep the practice floating within these difficult years of COVID and all of that. We started November 2020 in the middle of the pandemic, and we've been growing. We've been growing, and hopefully we're gonna keep doing it. In my practice, what I do every day is I do general primary care, but also I every patient I talk to them about that lifestyle medicine pillars. There's no patient I touch in the clinic that doesn't have one of the risk factors where we can work on lifestyle medicine interventions. There's not one. What I normally do, first of all, I have posters of lifestyle medicine related topics in patient's room. I have one. I love the nutrition. I have to talk about nutrition tips and things like that. I didn't get that poster as an introduction to the conversation on nutrition, and then I have another poster on the side about physical exercise. Those two pillars are the first I touch always. I see a patient for the first time almost every day and talk to them, history assessment, things like that. I order labs. Then second visit, we start the conversation. And because of my practice, I have no rush at all. I always spend the second visit like 35 minutes just talking about lifestyle medicine, depending on the risk factor the patient has and their problems. Most of the time, they come with their loved one, the wife, the daughter, parents, things like that. And it's even better because I can reach out to more people in the house. Then I start talking about nutrition. And it's difficult because the cultural parts, panic population, you don't tell a Cuban guy not to eat meat. That is out of things. So I have to be very carefully with that. No, but because I know the culture and in general the Latin population, Latin American public, I go through the site and they ended up. I'm being having a lot of very successful stories with my patient in the short term. In the short term, like cholesterol, weight loss, and improved sleeping, and improved tiredness and fatigue during the day, has been amazing. The results I've been getting with this kind of approaches. It's amazing how the most tough guy, how they came back with doing intervention, doing changes. The most important, I go with them step by step. I don't rush them. I have to see him or her in 4 weeks, 3 weeks. I see him or her and go from there and go. Every visit is a challenge, and I've been working about that so far, that in that fashion.
Oh, I love it. I love it.
Mm.
And one of our questions was going to be a patient success story, but before we get to that, will you
No,
tell us about your staff that is there in the clinic and how they also either are part of the lifestyle medicine movement or support you? Like, what are the supports in place?
it's curious because everything was thinking was arranged since the beginning. I started practice thinking lifestyle medicine and put a challenge myself on what to do. For example, the office manager, she being struggling with weight, being different in age in her life, were being struggling pretty hard. And I go, you know what? I want you here as his office manager, and we together gonna change that. She actually, she's changing. She's losing a lot of pounds. She's more happy, the happiest moment in her life at this time. And someone the front desk, and she is very aware of our lifestyle medicine pillar. She's the one who look in the ACLM website. She's the one who give the printout to the patient on those 7 days recipes, breakfast, lunch, snack. I give all my patients that I can. I give it that recipe for the 7 days. I give them the ACLM website, and she's the one who helped me with that. And the front desk staff, I put very special attention to patients that are obese, moderate, and severe, and I give them all the option I can give them as a primary care provider. And things, lifestyle interventions, when I see there is too much obesity in the middle, I offer treatment, even medication treatment to them. And I offer bariatric surgery as well in the case the patient could qualify for that. I have a special patients that I treat that way, and the front desk staff also, they contribute to that information and managing the patient through the system as well. And my medical assistant, she is very conscious on what lifestyle medicine is. She also was a doctor in Cuba. He was family practice physician in Cuba, and she's helping me now with her knowledge to approach to the patient since the beginning, since the patient stepped in the room. That's my office staff.
Oh, I love it. Yeah, sounds like you have people who are on board with you.
Oh yeah,
So
yeah. All
that's
of them
great.
are.
Yeah.
Yeah.
And so, what has been the biggest barrier, do you think, with patients? Is it the culture? Is it we're all part of whatever culture we grew up in, but what do you think are some of the hardest things for people to overcome?
Yeah, culture is part of it. It's a mixed culture is part of it. Like I said before, some patients are so hard. The key here is not don't give up on them. Be there always for them. Whatever they decide at the end, if they don't, you keep with them. Keep because you got other resources you can help them with. Other thing with patients is it's about I don't have that time that I would like to have all the time to dedicate to them. I don't have a team of other members of a nutritionist or wellness coach or anybody that can help me with this. I don't have a program established. I tried to start a program, but nobody came. So I need more resources, that kind of resources to be able to take my message to more patients and do something actually that cause an impact, a real impact, more massive impact in my patient. I'm willing to do a program to, but unfortunately down here in Southwest Florida, there's not too much of a movement. And we are trying to get their Lee Health, for example, even more they used to, but I don't know what happened to that movement. I haven't heard anything. And so on, Dr. Dacanina is around here. We are alone practically. So we have not too many advocates. I think that probably is the main barriers from patient side, cultural, and I think that I need something after my word, what I talk to the patients. I need something to continue outside my that I cannot control everything. I'm alone practically here, so I needed that resource, and that's from patient side. And the other barrier is billing side, insurance. That's always a barrier. I'm trying to talk to insurance and Aetna to get something about capitation in commercial patients to see if we can reach something, but so far haven't had any success.
Right. Yeah, that's what I think the reimbursement part is. There's a lot of conversation around that piece. And I really feel myself personally, I have my own health coaching certificate, but I feel like health coaches are going to be integral to us moving this forward because it's really the behavior change that people need help with and support every week or however often it is, more so than what a medical provider can maybe do with them or for them. Yeah, it sounds like a multidisciplinary approach would be great. And I knew that about Lee County in particular, that there was a lifestyle medicine movement there. I think the pandemic sort of
Mm,
derailed some of our efforts, maybe. That's just my own opinion.
probably, probably, yeah.
Yeah. So, what do you think some of the barriers might be to that wider adoption of lifestyle medicine? I know in the introduction and on your website, it also says that you're really passionate about this being just part of the fabric of like medical care. What do you
Yeah.
think some of the barriers are to making that happen?
I think first of all, we here have we have a bigger problem also that is not only pertain to patients or my practice, or it's a system problem. It's a healthcare system problem. The same insurance, they don't know anything about lifestyle. They don't want. It's a very money driven system, and unfortunately, we all know that things in every country in the world is run about the same. Preventive medicine doesn't bring money on the spot. They bring money because they improve the health of the population. So that's the main, and that of course is going to be translate in better health indicators, very health. If you see things like from that perspective, of course you're going to be saving a ton of money at the end. But unfortunately, because it's a money driven system, they don't like to look so far away. They want results in the short term, and that probably is a problem or issue. Also, the education in our school, in our nursing school, medical school, education is not addressing at all lifestyle changes. It's impressive. There's starting being some kind of light on medical school and nursing school about lifestyle medicine and lifestyle medicine pillars. I was impressed how, for example, my daughter is getting to medical school now, and they were talking to her about whole food plant based. What? Yeah, and she likes that, and she knows about that already. She's been with me, and she was astonished at how in that school they talked to her about lifestyle medicine or pillar the lifestyle medicine pillars. And there's actually a course that talk about that. They have cooking class, they have kitchen in the school. So it's amazing. Some steps has been are in motion now. There is a spark of light, but in general, the education system need to be addressing more this pillar that we sure everybody knows that are their work.
Yes. And I would love to know where your daughter's going to medical school.
Oh yeah, I'm so proud of her. She's got in Pittsburgh, but then Hopkins called her, and she gonna finally got into Hopkins. So it start next month. So I have to travel over there this week.
Ah, nice. That'd
Right.
be so exciting.
I'm so happy.
And I feel like I've heard a lot of movement because there's a couple of physicians in particular really passionate about getting this into medical schools. And I feel like we need the same excitement to get it into nursing schools as well.
I'm so happy seeing. I don't remember her name. The in Gulf Coast University here.
Uh-huh.
What's her name? I know her.
Is it Laureen?
Lorraine.
Laureen? Uh-huh.
Lorraine. They have a group here that is a lifestyle medicine group, and they teach lifestyle medicine. I'm being preceptor for a couple of students from there, so I'm
Oh,
so happy.
nice.
I had to contact her, by the way.
Yes,
Right?
yes. We're hoping to talk to her too.
Yeah.
We
Yes.
know there's good things going on. What do you think? You already mentioned ACLM, but what do you think the best way that you, as being a busy medical provider, can stay up to date with what the science is around lifestyle medicine?
Yeah, it's difficult because there are a lot of things I would like to dedicate just to lifestyle medicine, but there is other topic that we have to also be on top of that. And the ACLM website has been a very resourceful tool for me. Very the AGN, the magazine, the all of those resources have been very helpful. The articles that I have to read to be able to renew my certification also has been helping me. I've been getting from there other links that have been taking me to all of those evidence-based new resources that we need that much. We need so much. We need that. So to show and to prove that lifestyle medicine is really what we talk about.
Right. Yes, I love those articles too. And I through the if you're a member of ACLM, I don't get any money. I'm just saying if you're a member, for anybody that's listening, you can also have access to the American Journal of Lifestyle Medicine,
That one,
which is yeah,
the AGL,
AJLM, huh?
ALM, that
Yeah.
one articles. I have to go. I have to say I have to go more in. I haven't had time to go, but I have to go. I was thinking about that last night. And also, I'm in the diabetes course.
Oh, I love it.
That one, I love it. I think I'm the middle of the course, and I think it's very instructional and education part of it. I'm learning a lot.
Yes, I
Learn-
loved it. I did that course myself and I thought it was pretty phenomenal.
Yeah,
So,
and they change it now, so it's
yes.
good. It's been very good to have it.
What recommendations will use lifestyle medicine or bring it into their practice?
First, this is something that you need first. Take a look at it. Go to ACLM. See if you like it. See what it's talking about. See the pillars. Understand the pillars. Talk to somebody that knows about it. Once you decide, it's gonna be what you're gonna be breathing, what you're gonna be dreaming, what you're gonna be living for. You're gonna be drinking, what you'll be eating. It's gonna be everything in your life. That's my advice. And with all of that, don't never give up. Never give up on the patient. If the patient is not successful with the changes, keep with them, keep with him or with her, and you're gonna see that you're gonna make the impact because it's all about what you said before. It's all here. The patient that the problem start always up here. If you keep them with support, if you support them, you're empathic with them, they're gonna be following you one way or another at the end of the road. That's my main advice to them. And there's a movement. This is a movement. We need them. We need all the nurses that can join the movement because this matter. This is what is matter in health.
I absolutely agree. And it's like I had a doctorate student with me this summer, and she and I were talking like, once you learn this stuff, you can't unlearn it. It's not like you can't unsee it. And
Right.
you can't go back to what all the way to the way you were taught. You move forward with this information because it is so powerful. Um,
Yes.
yeah,
That's so true. That's so true.
yeah,
Very powerful.
yeah. So, would you like to tell us? Do you have one story you could share with us? One patient story?
Yeah, I have a couple of them, but there's one that was at the beginning, actually, of my journey on lifestyle medicine. It was when I was still working for that big company, corporation. I had a patient that was in the 40s, Cuban lady. that went to the practice to establish. And she was feeling tired. It wasn't obese, it was like overweight, 20 something, 29 BMI, like that. No any chronic condition or anything. Don't take any medication, just ibuprofen for headaches and things like that. And when I received the blood result back, I seen the liver enzymes very high and the cholesterol also so high. And she was saying, I don't know. I just eat one. You know what I eat. Okay. All right, dear. Let's do something. Because you have this liver enzyme, so I send a ultrasound liver. Of course, very severe fatty liver. I sent her to a GI for a fiber scan to see how much deep. And but in the meantime, I advise her and start her. And I spent like more than 30 minutes talking to her about nutrition and exercise. She wasn't doing any of those. Nutrition. I was talking about whole food, predominantly plant based, but I talk about just plant based also to get the two options. And she went home. She went home. And talk about exercise 150 minutes. She went home with the referral thing, and then a month passed before she got an appointment with the gastroenterologist and consequently the fiber scan. But in that month, she dedicated and she followed every word that I talked to her in terms of whole food, plant based, very plant based. The husband was with her in this visit, and he was, oh my, what did you do to my wife? I'm hungry. All the time starving. I can't eat anything else like just what she cooked for me. You know what? And he was benefit also. So at that time when he came, okay, he went to the GI, and the GI had the ultrasound and the fiber scan and was impacted by the fact that the fiber scan didn't show any fatty liver, no fatty liver. She called me and said, what happened with this patient? It was her ultrasound? You sure that was her? Yeah, it was her ultrasound. The patient lost like 12 pounds. Cholesterol went back almost to normal. Liver enzyme normalized. And the patient was in the happiest way, in the happiest form of her life. Never feel like this. It's so energetic. All the time wanted to do something else, hyper. So happy to be able to do that. So now that is my success story. And after that, what I was very sad was not able to continue. What's next to keep her with that impulse and not to have her to go back to that. Then I left the practice. I couldn't get in contact with her anymore. After that, I've been doing this and again, and I know it is possible to improve the health of the population without almost no medications, just lifestyle. It can impact a lot of point at the same time, a lot of very important part of your life at the same time. Improve your lifestyle, improve your mood, improve your physical condition, improve your pain, improve everything. I don't know how people don't see this.
Right? Maybe they just need a few good cases.
Mhm.
All right, thank you for sharing all of that. I want to send it over to Deborah for a minute to maybe talk about some of the nursing, the future of nursing report, and anything from that direction. Deborah, do you want to take a couple minutes for that?
Thank you so much, Susie. And wow, Dr. Barata, that is really powerful, all that you've shared with us. I would love to first circle back. One of our goals is to create content and assets for our nursing community going forward to support them. So I heard a couple of things. One is tools for those that are in a practice like yourself, where you can get your patients connected to, whether it be a coach or an RD or just a monthly community, that kind of thing. Wanted to see if you had explored any of that, what worked, what didn't work, what ideally, if you had a magic wand, you would have
Mm.
along those lines.
I've tried to implement a program, for example, in the past with a wellness coach, health coach from the Adventist church nearby. There's in the community. She was very willing to do it, but it, it was just her and myself, and we didn't. It didn't go through. It didn't go through. We have all the technological equipment. We have PowerPoint. We brought a few patients, but at the end, again, those programs, for example, the former chip program, the Jumpstart program, they're very good programs, but they cost money to the patients most of the times, and they're not covered by insurance. None of those are covered. And I have a chip program here locally, but it's money wise. It's we go back to the same circle. Trying to do something. Actually, I want to contact again to the people that are within the program to see if we can do something different. If something has changed since the last time we talked, because I think that will be of help. That will be of help. So there is some conversation also that GCU, Lori is doing with different hosts that she invites to talk about lifestyle medicine to the university. I think that also is something that is powerful because they are listening. They are the students, nursing students are listening lifestyle medicine. So that's a good thing too, a good tool that they good thing they're doing it now. Other thing that I've been reach out churches to the church. There's a couple of churches that I've been reaching out. I'm planning to go next week to one of them on the Tuesday where they have a long line. They distributing food in the church, and then we're gonna be there with a tent, trying to give him a little bit of awareness of nutrition and lifestyle medicine. So let's see what happened there. Also, this coming week, the next weekend, we're gonna have a back to school fest here in the parking lot of the office, and we're gonna be participating too. So that's gonna be also another thing that we're gonna be doing. So I'm trying to revive this, to get it new vibes, and to try to go back to what I love. But again, the main barrier for me in this case, it will be lack of the network that can work with me. If I can implement a network, or maybe online network, I don't care, an online team of nutrition or health coaches that I can reach out, the patient can reach out, and we can agree on something, that would be also a good thing to do. And that's mainly what I'm doing right now, of course.
That's a lot. And as the provider there, there's just that limit of time and energy and resources and being able to do things then on the weekends or evenings. And so it
Uh,
sounds if partly it would be connecting with uh, online programs or possibly programs that can be scaled according to income. It sounds like one of the things you're very sensitive to for your patients is that financial barrier and the sustainability that they need ongoing support because, as we all know, we send them out there and then they're out there, right, to
yeah,
all of the fast food and the stressors. And how do we keep that energy going and support them while we're not seeing them until we see them that next time? It sounds like that's a place for need for supporting lifestyle medicine nurse practitioner led practices like yours.
exactly.
Um, May I also ask about reimbursement? I know Luis, when or Dr. Barata, I know that when we spoke last year in Orlando, you were considering getting in being a part of, I think it was a Medicare where
Yeah.
you were, yeah, is that the large group that you were talking about, just to clarify here? And then are you part of that where your lifestyle outcomes with the patients are helping to offset some of the others in terms of the outcomes? This is we'll have to edit my intro there, but just trying to clarify where we were when we spoke in Orlando to
Right.
today and that practice model with the
Um,
Medicare.
yes, this is it sounds good, a good idea. The only problem with that is that only for straight Medicare patients. It doesn't cover the insurance. The Medicare patients that are through a HMO, for example, those patients that are not straight Medicare, and I don't have too many of those. I really don't have. I have a handful. It's not working like I would like to because there's no patients. to enroll with. So, and that, but yeah, it's a very strong program. They have all of that. What we talking here, they have a network, they have a website, they have health coaches. Where, but it's just for Medicare, straight Medicare patients that are elderly, and they sometimes very hard to change. The I would like to have this for commercial patients, for example, for patients that are now at the time where we can prevent those outcomes that we don't know, the cabbage, the heart surgery, the kidney failures, and all of that. Medicare patient 70s, they are they just have they already have it. We can do secondary prevention, but lifestyle medicine, the impact, I think the lifestyle medicine will be in younger patients where we can impact more the most on those risk factors, big risk factors. But yeah, it's a good idea, it's a good program, but I haven't me personally, I haven't get involved enough yet to say something about that. The other is
Say,
I'm sorry.
go ahead, go ahead.
The other is I have a capitation with them on Medicare side. I'm trying to get their attention to present something to them so they can capitate commercial patient as well. So we can work more in terms of frequency. Maybe with that capitation, I can hire somebody else, somebody to help me with the mental part that is very important to address and need time to address that. I'm seeing like 20, 22 patients a day. It's so hard for me to keep it up with all that I want to do. That's regarding that.
As you've shared eloquently, it's the system, trying to heal our patients by addressing the underlying causes and empower them in a system that's built on pills and procedures, and being a sole provider within that system makes it doubly challenging. One of the hopes that our dreams coming out of this Lifestyle Medicine 2023 presentation is to develop assets and to ask for experiences of nurses across the country and sharing. The other, such as yourself, and thank you, the other is to try to put together a picture, almost like a Venn diagram, of a couple of amazing forces that are out there. And we're not sure yet, we're working on this, to what level all of these are coming together, but how powerful we believe it will be to merge these passions and energies. So one is our lifestyle medicine community, as you've shared so much about the power of ACLM to transform your life and the power of the materials there and the power of lifestyle, even from that first patient there. The second is the National Academy of Medicine and the report called The Future of Nursing. There was 2010, 2020, and now post-COVID, 2020 to 2030, where COVID shone a bright light on the fact that it is social determinants of health, things like zip code, things like access to healthy food, stress, all of that, that are really the drivers of our health outcomes. And then the third is the education that you spoke of, how beautifully your daughter's starting to experience the new way of educating. And we're hoping that this is also going to be transforming within our nursing and the nursing essentials that's new. Wanted to ask about the future of nursing, and if I could just share briefly from it. The future of nursing 2020 to 2030, the theme is charting a path to achieve health equity, and how we as lifestyle medicine educated nurses might lend our insight, education, experience, and passion to this effort. And a quote from that is, nurses are trusted bridge builders who champion good health for all. The Future of Nursing report explores how we can and must unleash the power of the nurse, that's nurses at all levels, to achieve health equity, and how the systems nurses function within must do more to educate, pay, employ, and enable nurses to support nurses so they can do more.
Yeah.
From your experience with all of this, and also the unique place you have as a physician and coming from other countries and seeing outcomes and models there, might we ask if you could spend a little bit of time with us sharing what you think about the future of nursing, call for nurses to help lead us out of where we are today, and how we are uniquely equipped and positioned with, I think, 3.7 million of us, and then all of us coming together here in lifestyle medicine and the synergy there, what you would say to all of that, and if you had a magic wand, what you would create.
First of all, like you said, I've been in the both sides of the river, and let me tell you, there is no professional in the world where I've been working better equipped to fit the lifestyle medicine pillars and educate our population than nurses. There's not a better, I don't know, that profession, this profession that we practice was created for that. That's the whole profession for me, for my experience, is to educate, is to prevent. After that, all you want, there is a lot of professionals that can do the job of lowering blood pressure. But to prevent that patient that you're treating today for a heart attack, get there is so powerful. And that's only belong to the nurses. That's why I'm here. It belongs to the nurse because that was my foundation when I studied medicine. That was my foundation. It would be so beautiful that medical school in the US also address this in from this from this fashion, in this kind of fashion. It would be amazing because that's the foundation of medicine. That's the foundation of medicine. Prevent, like Hippocrates said in 16th century. Let the medicine be the food, and the food be the medicine. And that is so powerful as well. So nurses, in one word, nurses are the best equipped professional in medical profession that are fitted and are dedicated for lifetime medicine. I think there's no better professional than us to take care of this. This is ours.
It's so moving. I had to not cry there.
I'm sorry.
It's so beautiful. No, that's very moving, and particularly having, as you said, come from both worlds, and the passion with which you share about all of that. Any thoughts about how we might support, any unique things that you would really love to see that we can create in this time that we'll be sharing with nurses and hopefully others at the conference, and also resources or assets coming together? Would there be lists of resources? Would there be ways of utilizing a nurse billing for time, or a care manager, things like that? Are there any other specific things that you feel would really support you in your practice there?
Yeah, first of all, let the nurses work and practice to the full extent of their license. Let them to work. Don't put barriers. Let the insurance, ask the insurance to please pay for the time. We need to start thinking of nursing not as we were used to think before and other times. Just think as a nurse, as an independent provider that can have a unique impact in patient health. Let them to do their job, and then you're gonna see the results. Remove barriers that we know that exist today for us to practice, and then you're gonna see results. I'm guaranteed that you're gonna see the results in the short term, even because this is short term. When you engage a patient in 2 weeks, you're gonna see the difference. Patient gonna see the difference. It's gonna come back to you. I'm so happy. I feel different. Yes, you feel different because you're doing the right thing, and the nurses are the responsible for that. Imagine in only 2 weeks, you're gonna see results. What else you want? I don't know. As a system, it's powerful. Let me tell you, everything that is coming from the heart is coming from the heart.
So valuing the nurse contribution based on outcomes and the time with the patient, and helping them move that patient, assessing that patient for their who they are, where they are in their culture, in their community, in their environment, their economics, and then, as you always say, support them, be on that journey with them, and valuing based on that those outcomes, as opposed to on, I guess it's a capitated system where it's just based on, okay, I saw them and I gave them a blood pressure pill and I'll see them next month. That kind of
Exactly. So, and we as nurses are only one that see the patients from the holistic approach. Believe me, we are the only ones. There's no other one. There's no other. We are the one who see the patient. We understand the patient, and we listen to the patients. And that's only that is account for all the pillars of lifestyle medicine, and that's what we need to start doing. Listen to the patient, not rushing the patient, and be more empathic and more supportive of what the patient needs are. Those are very, very fancy words like patient decision making, patient decide everything. But in the real life, we know that we are a little beyond that, away from that yet. We're not there. We're not getting there yet. And nurses are the one who gonna get there. They're not getting there because the system is not allowing us. Still getting there. But the holistic approach we have means everything for the patient. Means everything. Forget it. So I'm very convinced about that, and that's why I practice that in my practice. I practice that kind of medicine, more nursing medicine than diagnosing or do something like treatment, things like that. You find that in the book. Your UTI, you see all the treatment that UTI for UTI. That's the top thing. That the top is the other thing to cure the patient without pills.
Thank you so much. It's so beautiful how you've captured all of that, Dr. Barata. Thank you.
I'm convinced about that. And
Thank you.
you're welcome.
Really touched my heart just sharing and describing that.
Yeah.
Susie,
First
yes.
time I do this, okay? That I share that deep of thinking on.
And it's what brings meaning to the relationship. And that's what people, anybody, in whatever relationship you have, and especially the provider patient relationship, having that trust in a time when trust has been threatened, I think is really important.
Yes, and nursing profession, we've been the most trusted profession for I don't know. I lost the count. I don't know how many years already. It's 15. I don't know,
Right.
2 years.
Yes, absolutely right. Dr. Barata, thank you so much for sharing all of this today. I know we've taken a lot of your time today, so I appreciate everything that you share with us. You've been very heart centered and authentic, and I think it's going to resonate with so many people. So I thank you so much for that.
Yes, I'm so grateful that you guys give me the opportunity. I'm so happy to be able to be here and share with you from my heart what I feel about the
Yeah.
process and the movement of lifetime medicine and
And we'll
population.
just keep getting better.
This is just gonna keep getting better and better. There's no doubt about that. I'm sure about that.
Thank you. And I just want to share too from where we sat last year in Orlando together, had lunch and sat around in the courtyard and all, and
Mhm.
this journey of courage, going out and doing this is not for the faint of heart, and the courage that you had of your conviction to go out and this is worth doing,
Oh
and
yeah.
the
Mhm.
struggles of it, and the determination to stand by this because you, as you said, you can do nothing else than this once you know about it, you saw it in your own life and all. And then also to continue by your patients to not give up, to never give up, because one day that light is going to go on and they're going to, you help them believe in themselves until you believe in them until they believe in themselves,
Yeah.
and just that relationship that you describe, and all of a sudden they're making these changes. Might we ask lastly, before we officially end, and then we'll conclude the recording, but is there any last thoughts that you'd love to share with us or the audience, other nurses, other stakeholders that will be hearing this?
Just that lifestyle medicine has saved my life, first of all, in many ways, but also that has saved my life personally and professionally because I've strengthened my trust in helping people and it's have prevent from me to get discouraged for the system and be able to concentrate in a better way to help and a new way to help our patients, which is for me what I do. That's what I do all the time, 24/7. That would be all.
Thank you so much.
Yes, I love
You're
it.
very welcome.
Thank you so much again for being with us.